Hey everyone, and thanks for checking out today's session, Telehealth in 2023. I would like to direct your attention to the disclaimer here at the bottom of your screen. The information contained in this presentation is for general information purposes only and does not attempt to provide medical, mental health, or any other type of healthcare service. This presentation is not intended to be an alternative to medical treatment, and the content of this webinar may not apply directly to specific circumstances. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep this information up to date and correct, we make no representation or warranties of any kind, express or implied, about the completeness, accuracy, reliability, or suitability with respect to content. The telehealth team at the REC is made up of myself, Jared Deason, and I'm joined by amazing colleague Robin Kernel, who is our team lead for our telehealth. Today, we're going to talk a little bit about the COVID-19 public health waiver and where the waivers currently stand, Kentucky Medicaid's approach to telehealth, CMS's fee-for-service final rule regarding telehealth, and we will wrap up with how the REC can be a resource for your practice. So let's start by diving into the public health emergency. To get started, let's briefly take a look back at how telehealth under Medicare looked prior to the COVID-19 PHE. Telehealth under CMS looked pretty different at that time. It was limited to very few services, specific list of providers, and the technology was pretty limited to just live video only. Patient locations were also restricted, and that the patients needed to be in certain types of healthcare facilities in rural areas. Also, FQHCs and RHCs could not be at distant site at that time, meaning that the provider seeing the patient could not be located in an RHC or FQHC. Then came COVID-19 and the public health emergency was declared. Medicare released waivers that really blew the doors wide open for telehealth services. There were several flexibilities afforded, which included the originating site requirements, were released to now include homes in the other healthcare facility. CMS was added behavioral and patient education services and a few E&M services to the list of services eligible as audio-only visits. Patients new to a provider can participate in telehealth visit without the fear of the Health and Human Services audits confirming an existing relationship. There was no penalty for limiting or eliminating deductibles, copays, or coinsurance. And all healthcare professionals eligible to bill under Medicare were able to bill professional services that were now be able to use via telehealth. So to expand a little bit more about the PHE, on October 13th, 2022, the PHE was extended to January 20th of 2023. The Department of Medicaid Services currently anticipates that this federal PHE will continue to be extended through the summer of 2022. It's extended each time on a 90-day basis. Health and Human Services will provide states with a 60 days notice prior to the termination of the PHE. The Consolidated Appropriations Act of 2022 provides a 151-day extension post-PHE on some of those flexibilities that were in the previous waivers. And the Health and Human Services has allowed providers to see patients in good faith through everyday communication technologies, such as FaceTime, Skype, and Zoom during the pandemic without violations for HIPAA. Looking a little deeper into the PHE, there are around 240 different codes that providers can bill for reimbursement. Reimbursement was set to be equal for a telehealth visit as it would be if the services were rendered in person. Both the provider and the patient can be in their homes for a telehealth encounter. Live video is the preferred means of delivery, but there are a few E&M services that can be reimbursed for audio only. For RHCs and FQHCs, there are closer to about 275 codes that were approved for reimbursement. The reimbursement rate is currently set at $92.03. And like other providers, the originating site can be the home, and live video is the preferred method, although RHCs and FQHCs have a little more leeway for audio-only encounters being reimbursed. Modifier G2025 is to be attached to claims for services delivered via telehealth for RHCs and FQHCs, and they can be a distant site for providers. The Consolidated Appropriations Act went into effect on March 15th, 2022. And really all this is an extension for some of those flexibilities that the PHE had granted to give healthcare providers a transition period to pre-pandemic standards. Some of the highlights from the act are listed here. The biggest highlight, though, is that the act expanded upon the list of providers eligible to receive reimbursement for services delivered via telehealth. Let's transition and take a look into Kentucky Medicaid's program and their approach to telehealth. Kentucky defines telehealth as using synchronized and asynchronized technology, remote patient monitoring, and audio-only encounters. Store and forward is reimbursed under certain circumstances by Kentucky Medicaid. Medicaid requires a telehealth provider to be licensed in Kentucky or is allowed under the standards and provisions of a recognized interstate compact to receive reimbursement for telehealth services. Kentucky does have payment parity laws in place, making telehealth coverage equivalent to in-person visits for Medicaid patients in the state. Here's a list of eligible providers by the Kentucky Medicaid program. This list includes all providers, APRNs, occupational or physical therapists, and more. Kentucky Medicaid program goes on to further define that a telehealth provider is a Medicaid provider who is currently enrolled in a Medicaid program, currently participating as a provider in the Medicaid program, operating within the scope of the provider's professional license, and operating within the provider's scope of practice. Kentucky Medicaid has listed these services as eligible for reimbursement when delivered via telehealth. They do not, they have this disclaimer here in the red box that services will not be reimbursed, but really as long as the provider is cleared to bill under Medicaid, then services will be reimbursed for telehealth. I wanted to highlight some great resources for telehealth information, not just regarding Medicaid, but for all payers in the state of Kentucky. The Centers for Connected Health Policy is a great resource to stay up to date with federal legislation that's ever changing with telehealth. The Mid-Atlantic Telehealth Resource Center is a great website to find Kentucky-specific information, as well as surrounding and like states. They have information about the Kentucky Medicaid program, CMS, and the policies that are in place in Bluegrass State. The state telehealth program is where you can find all the information about Kentucky's cabinet's approach to telehealth and where you can find all the policies and regulations that have been put in place during the PHE. So now let's take a look a little about the CMS fee-for-service final rule and how it's going to affect telehealth in 2023. First off, I wanted to share Medicare's telehealth service list where you can find it. It's not easy to locate. The link at the top of your screen here will take you to CMS's website, where you'll be able to download a zip file with every code currently cleared for reimbursement by Medicare. There are a total of 264 codes on that list. They fall in one of these four categories here. Category 1 and 2 are services that are permanently on the list and will not be removed once the conclusion of the PHE. There were 5 new codes added to the permanent list under a Category 1 basis. That meaning that these services are similar to services already on the Medicare's approved list. Category 3 is temporary list of codes approved by CMS and are available up to the 151st day of the conclusion of the PHE. From CMS's 2023 final rule, there were 54 new codes added to this list on a temporary basis. Looking at Category 4 here, it's pretty interesting. These are codes that will be available through the end of 2023. This is a flexibility that CMS has granted in hopes that there will be enough data and justification to add codes on this list to the permanent list. CMS is really encouraging providers and interested parties to continue submitting justifications if they want to see these codes stay. Here's a list of those 5 codes that were added to the permanent list in the CMS's fee-for-service final rule. Again, these codes were added because they were similar or relating to services that were already on the approved list. Now let's take a look at some modifiers here. Modifiers have been confusing in the past. The CMS is working to clear that up. From the final rule, there were 3 codes highlighted. These modifiers are modifier 93, modifier 95, and POS 2. Modifier 95 will continue to be billed along with POS code corresponding to where the services would be furnished if it had been in person. And this is through calendar year 2023 or through the 151st day after PHE ends. POS 2, which is used for services furnished in a facility as an originating site, will go back to pre-pandemic standards on the 152nd day after the PHE ends. And modifier 93 is appended to claims as appropriate for audio-only communication through the end of calendar year 2023 or the 152nd day after the PHE ends. I have to admit, I was a bit disappointed with CMS that they didn't make more drastic changes for telehealth. The biggest takeaways were CMS not finalizing to maintain any of the Category 3 or Category 4 codes that are currently supported under the PHE. Direct supervision is expected to revert back to pre-pandemic requirements. CMS did not propose anything on allowing patients the ability to use their home as an originating site. Codified the Consolidated Appropriations Act and the 151-day transition period. CMS is really offering an opportunity here for feedback in the later stages of the PHE. So healthcare organizations should really take advantage and use this time to advocate to local, state, and federal levels of government to sustain the use and reimbursement of telehealth beyond the public health emergency. So how can we help? The REC can assist in the review of the facility layout and viability of telehealth adoption in your practice, design and update workflows around physical locations of telehealth services for compliance, assist in the development of billing and reimbursement procedures for telehealth services. We can help create comprehensive and clear telehealth policies and procedures. We can help you ensure that your telehealth program that you are establishing is sustainable for the years to come. And ultimately, we want to help you increase patients' access to healthcare. Besides telehealth, REC can be of even more assistance. For those of you that have been working with us for a while, probably have seen this slide before, but some of our newer folks may not know. The Kentucky REC has been around now for about 12 years. We provide services all across the Bluegrass, and we have helped over 5,000 providers in Kentucky. We have a pretty large footprint with Kentucky's FQHCs and RHCs, but we work with all healthcare organizations in the state. We assist with HIPAA project management and vulnerability scans, PCMH and PCSP consulting, value-based payment, QPP support, quality improvement support. We also have hospital-specific services with promoting interoperability, HIPAA security, and hospital quality improvement. Here is your clue to the Scramble Scavenger Hunt. Please be sure to check out other live and recorded sessions to gather all the clues to spell out the correct word. Winners will be mailed a prize following today's conference. So thank you everyone again for checking out today's telehealth presentation. If you have any questions, please reach out to me or our team. Our contact information will be in the bio of this session, and we'd be happy to answer any questions. Have a wonderful rest of your day. Thanks.